Hi, Mihaela. It's a pleasure for you to be here with you today for the Q&A. And at this time, you'll be taking questions from the audience. If you'd like to either communicate them in the chat, also in GatherTown or Zoom. So it looks like we have a question from an anonymous attendee. Hello, thank you for the talk. I have a question about the NPI you use for prediction. One of them relates to contact tracing. Do you take into account the fact that this measure was different for every country? For some of them, it was mandatory, for others, it was not.
So thank you very much for this excellent and complicated question. We have, in the initial data that we have used all the different NPIs that were available, for which data was available and collected. Many of the countries at the beginning of the pandemic didn't use indeed contact tracing. We did use information about this, but only in the later stage of our analysis. And the reason I said it's interesting yet complicated is because contact tracing is in certain countries a very complicated issue, both from a cultural point of view, as well from a cost point of view to implement it correctly. Here in the UK, for instance, it took a very long time to implement effectively a contact tracing strategy. So because of that, the impact of it in the different countries is as well different. So the answer is yes. We have considered that in the more recent data, but one needs to be very careful when interpreting this information because of the noise associated with it. Yeah. So
Okay.
just saying that I have a contact tracing implemented may not be sufficient. About the quality of the contact tracing may be needed as well if one would really want to assess the validity of this intervention in the different countries. Yeah.
Thank you so much. So the next question we have is a question from Sinu. Hello, thank you for the great talk. GP fails with higher number of dimensions. What is the number of dimensions that you are considering?
So thank you. This is another excellent question. So in the initial model that we implemented, it was indeed based on GPs. So this is why I talked about GPs, because this corresponds also with the talk that my student gave at NeurIPS. But since then, because we wanted to make the model much more scalable, we have replaced it in the latest version with a deep learning model. So we have now a recurrent neural network that is doing that. If you want to see this newer version, please take a look at our website where we have this demonstrator. And you are going to see there some slides associated with our newest model. And indeed, we have replaced the GP with a deep learning model since then to accumulate more, to allow for more data and more richer data sets. So it's a very, very good point. In both settings, though, both GP and recurrent neural networks, one important thing that we have done is to try to understand which out of the many features were important for what type of outcome. So in the presentation, I mainly highlighted the number of deaths from COVID-19. But if one wants to look at other things, spread, R0, other types of outcomes that could be revealed, that are computed in the inner belly of this model. We have a lot of computation that could be revealed to the user. Identifying what features are important for a particular prediction can be done with both GPs as well as deep learning models, and then one could decide to restrict the model to only those most important features. And feature important itself was part of what we looked at. That being said, you are completely right that you want to consider these many features. So that's why we move from a GP to a deep learning model.
Thank you so much. And what are some of the most pressing problems that you think we need to address in healthcare that are specific to COVID-19?
So I would say now that we have hopefully going to have very soon in many countries a vaccine, hopefully we are soon going to conquer this disease. So before answering the question specific to COVID-19, I just want to say that in the last year, because of the interest in COVID-19, many machine learning researchers turned their interest to machine learning for healthcare because they wanted to help. I really hope that people stay interested in machine learning in this topic. Machine learning for healthcare is a very exciting area with many interesting problems and it requires many brains to get engaged with it. So I hope many people who are listening will stay engaged even post-COVID-19, hopefully. But that being said, despite the fact that we are going to have hopefully quite soon a vaccine, still it will take some time till hopefully this will be effective in the larger population. So I still think it is extremely important to understand treatments and what are the best treatment to be given to patients and when. So for instance, together with NHS Digital here in the UK, we have done a study early in the pandemic, which just recently we published in BMJ, where we show that intervention early, if somebody is getting sick, they should be early admitted to the hospital. And this will have a very important positive impact on the patient rather than waiting at home. So looking at causal inference, estimating treatment effects to identify how to best intervene on a particular subpopulation is very important. Also, I think it's interesting to understand the differences between the different populations. So again, both in the UK and in Brazil, we show that the ethnicity of the patients matters a lot in the outcomes, and we still don't understand why. So I think that we shouldn't only just predict that this is happening. It would be nice if we as a community build tools to understand also why. So move from prediction and causal estimation of treatment effects into true causal discovery, where we understand how variables interact, potentially the genetic material of the patient interacts with other factors, to really try to understand the disease at the next level, which may help us with future diseases as well. I don't know what else to say, but I think lots of things that can be done. Yeah.
So that's a really fantastic answer. And we have another question from Sinu. Lockdown has brought a lot of devastation in countries like India. Can we say lockdown brought down the cases in these countries? I'm wondering whether NPI would work in this case.
No, so definitely, Sinu. So I would like to ask you to take a look at what we have done. Our demonstrator currently has mainly a focus in the UK because we are not excellent programmers and making it work at scale was difficult. But the methodology is generally available. And definitely lockdown, as well as masks, as well as other MPI interventions clearly show a big impact. I do not know about India and how effective was it there, but in the UK, we have a very clear analysis about the effect of lockdown, not only in the future, but also in the past. So for instance, we analyze what would have been the number of lives saved if the lockdown would have started earlier or later. So I think that one can use these tools to also try to do lessons learned. What were the most important interventions of the past? So also going back to your question, Crystal, I think that even after the pandemic hopefully is behind us, we can go back and try to understand policies and interventions. And for that, we, the machine learning researchers, need to join forces with policymakers, public health experts, managers, politicians even, to try to understand what would be really the effect of this. But the answer is yes, NPI as lockdown was used in our analysis.
Absolutely. Thank you so much. And then so we have a question from Nayana, and
Yes.
they ask about how you deal with all the data quality issues in modeling.
This is a very, very good question because, of course, this is generally a problem, not only in COVID-19, it's also a problem in machine learning for healthcare more generally. So first thing I'm going to say is that it is really important for us as a machine learning community to look at these dirty problems of machine learning. Can we come up with a better machine learning method to do data cleaning, data imputation, data validation. I think we don't spend enough time looking at such technologies. That's number one. And the quality of our predictions will strongly depend not only on the robustness on the machine learning model, but also of the data, as you rightly point out. That being said, we had big problems with the quality of the data, partially because even the number of deaths was computed very differently in different countries from deaths from COVID-19. So for instance, Belgium as opposed to United Kingdom, as opposed to China, very different ways of reporting deaths from COVID-19. So I think that to some extent, only later, when we are going to understand, for instance, the excess deaths, how many deaths we really believe were in excess this year, and how many of them could be attributed to COVID-19, even though they were not reported maybe as COVID-19, could be considered. So I would say in the moment, we use whatever data is available. However, I advocate that we should also do this analysis, redo this analysis over time, and understand what were the lessons learned also with respect to collecting data and how much this may have affected our predictions. So we had a lot of issues related to both inaccurate data, inaccurate covariates, noisy covariates, missing covariates across the different countries. But this is why it was useful to look across different countries, because we could at times learn from one country that may not have collected some variable or may collected it noisily for the sake of another variable.
It looks like we have quite a few questions in.
I will answer them in chat.
Okay, fantastic. So now we're going to wrap up and we're going to play another pre-recorded video. So please join us in the Rocket Chat if you have more questions from Mihaela van der Schaar. And thank you so much for
Thank you. Thank you for
joining us.
inviting me. Have a good NeurIPS.
You too. Take care.